I'd like to introduce Dr. Samyadev Datta from the United States, who's from New Jersey. Thank you for joining me.
You're very welcome.
Could you tell me when you first heard about LDN?
I heard about LDN about a year ago, and I actually met with a colleague of mine who I got introduced to in June of 2012. We were actually in a fundraising walk in Central Park as part of the RSD-SA Association's fundraising walk. And I had heard about it minimally at that time. Then I met Dr. Pradeep Chopra, who's from Brown Medical School in Maine, Rhode Island. And he introduced me to this concept of Naltrexone, low-dose Naltrexone, and started using the medication for the first time in August of 2012. Now, Naltrexone as a medication is not new to us in that we have been using Naltrexone for other reasons, but in the low-dose form was definitely a completely new thing for me, and has been a really exciting journey since then.
What conditions do your patients take LDN for?
So I introduced LDN to a group of patients that most often consist of complex regional pain syndrome, and I have a large number of patients who have complex regional pain syndrome in my practice, and it's not been an easy process to try and handle their pain processes. So when low-dose Naltrexone came along, I was completely open and eager to try it out, and must say that it has not been disappointing. It's been very encouraging. So complex regional pain syndrome is the primary indication that I've used it for. The other indications that I have had good success with are peripheral neuropathies. I've had it in for post-herpetic neuralgia, and in situations in which it hasn't been useful are things like central pain syndrome. It's not been a very successful process, but you know, it's still to be looked into and see whether that's going to work.
So if you have a patient come to you who would like to try LDN, or who you would like to try LDN for, and they're on opiate-based painkillers, how do you go about weaning them off the opiates?
So based on the amounts of medication that they are on and how long they have been on it, the process of weaning patients' medications can be either an easy or a difficult process. Now, people who are taking medications like tramadol, which is not a really strong opioid but a mild opioid, those people can come off the medications quite easily. On the other hand, if somebody is on heavier medications like long-acting morphine and stuff like that, it might take a little longer to get them off the pain medication. So I usually give them a schedule, and I work with them in that if they've been on these medications for a long time. I have a patient who had been on pain medications for 25 years and had an intrathecal morphine pump in place, and I finally got her off that medication, took her off, stopped the pump, but it took us a couple of months to do that because the process, she'd been on pain medications for such a long time that we just could not stop the medication suddenly. So, and I usually give them, for breakthrough pain, when I'm taking them off the opioids, I give them oral ketamine to help with the breakthrough pain medication, and I give them oral clonidine to help with the symptoms of withdrawal. So, but on average, I would say about 3 weeks is what I would say is the duration for what it is necessary to be able to wean patients off the opioids.
And have any of your patients experienced any side effects?
From the opioids or from the Naltrexone?
From the Naltrexone.
The Naltrexone per se, the side effects have been very, very minimal. And some of the people have said they've had some difficulty with sleeping. Most of the people have managed to be able to, resolve that, and they are able to take the medication at nighttime and are able to sleep. But some people have. The other thing that has happened with some people, and that is they have had one patient continue to have a little bit of diarrhea, and we tried to introduce the medication over and over again, and it caused diarrhea. So that happened over there. There was one patient who had oral candidiasis, and every time we introduced the medication to her, she would have this problem happened to her. So, and what else have we had? I've not had any other side effects. It's a pretty safe drug, and now that we've used it in about maybe 85 patients, it's been pretty good. So.
And how long would you say that LDN takes before the patient starts to notice improvements?
Every individual is different, and we've had patients who have had response with the first dose, and we've had patients who have taken almost a month before we have been able to get any results. But on an average, I would say within about 2 weeks, we get to know that they are responding. Most patients have required, I start the patients at 1.5 milligrams a day, and most patients have had to go up to about 3 milligrams. We have only maybe 2 patients who are at 6 milligrams, so most of the patients are between that dose of 3 milligrams and 4.5 milligrams, and they respond. So we have been able to stop, the pain medications in a big way. I have taken patients' morphine pumps out because I had put them in for complex regional pain syndrome. I have removed the pumps, and the story about this gentleman who comes to see me from quite a distance was quite funny. I took his pump out, and he came back for a follow-up, and he said, "Hey, Doc, if my wife was here, she'd be giving you a kiss." And I said, "Hey, listen, you're a married man, I'm a married man, we can't do things like this, So, but it's been good.
That's amazing, isn't it, to get people off of heroin? I mean, I've had so many people tell me who are in awful pain. Some of them have got multiple sclerosis, fibromyalgia, where the morphine hasn't touched the pain, but the LDN has. And it's just so amazing that something so small can have such a large effect on people's lives.
And the fact is that Naltrexone is not a pain medication, so by all scientific comprehension of how pain medications work, it would not make sense that Naltrexone is working. Mm-hmm. So it's been an interesting journey for that reason, that we are able to look at this medication and say, how did this happen over here? But it has, and all I can say, it's been over and over again that we have been able to get good results. So we're very pleased.
Well, thank you very much for sharing your experience with me.